Hello, friends, and welcome to another episode of the Concussion Nerds podcast. This episode, we're going to talk about some of the current research surrounding concussion and female hormones, particularly around what it means around our cycles and progesterone and estrogen and all these factors. Full disclosure, this is not my area of expertise. So for this episode, I went to the papers and to the research to pull some of the current things that are happening in this field. I am going to say the general consensus is we definitely still need more research in this area, right? When you look at some of the signs and symptoms of concussion and you look at when we started to separate and when we're starting to separate gender and look at males and females separately, we recognize that there is a difference, right? And we recognize that concussion affects females differently than it affects males. Females tend to be at higher risk for concussion. They tend to be at higher risk for symptom severity and recovery times. And so one of the theories around this is the female hormones. And so this episode, we're going to share kind of the summary synopsis of what I have found in the literature around female hormones and concussion. We will have an episode that goes deeper with someone who is more of an expert in the hormone space, but I wanted to give you kind of a tidbit to get you started. So I'm going to pull my notes out for this one because, like I said, this one went to the studies. So when you look at the symptoms that women experience more than men, when you start to pull this apart and look at the research, women tend to experience, in some of the studies say, more difficulty on visual memory tasks. And women also tend to be the ones, when you look at the studies, that seek out treatment sooner than men as well. And again, we can have that increased symptom severity. And so one of the thoughts is what happens and does it matter? This is the question. Does where a woman experiences a concussion in her cycle matter? And what the research is showing us ultimately is that yes, it does. So there is this theory that has been explored of the progesterone withdrawal theory. And so when you think of a female cycle, we have fluxes in the amount of estrogen and progesterone in our body based on where we are in our cycle. That second half of our cycle is our luteal phase, right? So we have our follicular phase in the beginning, which we have higher estrogen levels, lower progesterone. And then as we shift into our luteal phase, our progesterone levels are elevated. And so what's thought to happen is that the studies are showing that women who experience and sustain a concussion during the luteal phase, so that second half of our cycle when our progesterone levels are high, they experience a more severe drop in the progesterone after the injury. And this is what can be a factor leading to worse symptoms and slower recovery compared to women who experience a concussion in their follicular phase. So for us as clinicians, what this means is one of those questions that should be either on your intake questionnaires or that you're having when you do your verbal history, especially if it's a woman who is in the age range of menstruation. And let's be real, that starts as low as 11 years old, 10 years old in some girls today, and can go as high as 50, maybe older, right? So that is a huge window. So really, this should be a standard question for females who come into your practice. Where were you in your cycle? What day of your cycle were you on when you experienced your concussion? Right? Because if they come and tell us that it's in that latter half, so let's say day 14 through 28 in a typical cycle, we know that they're in the latter half of their cycle. And so that could be that they experienced a greater drop in progesterone and thus may have increased symptoms and a longer symptom recovery timeframe. Okay. So that, again, it's thought this is called the progesterone withdrawal effect. And so the studies are summing up that it could contribute to the lingering symptoms such as headaches and dizziness, and again, those cognitive symptoms with concentration and visual memory. There was a study that looked at this concept of a 9-day window of vulnerability. Okay, now I am going to preface this where this study was a small N number. And so this has been replicated, but not in every case. So this is, again, one of those theories and one of those thoughts that are out there. But this study had a small N, but looked at a different group of females and when they experienced their concussions. And after analysis, they discovered to find this 9-day window of vulnerability. And this is in the late luteal phase when progesterone and estrogen levels are both decreasing. And they discovered in this study that during this period, women may have had an increased risk of sustaining concussion. So their statistical number, they came out with a 66.7% of concussions in this one study happened in this 9-day window of vulnerability. Okay. So there was another study that looked at the role of the menstrual cycle and when concussion was experienced. And so this was a study of 144 females aged 16 to 60 years old. Okay, so let's add 10 years to the window that I just talked about. For 1 month after emergency department discharge. Okay, so this is the group they are following. And the study investigators found that women, obviously, who experienced their concussion again in the luteal phase of their injury had a significantly lower quality of life and indicators of health 1 month after their concussion than those women who experienced their concussion in the follicular phase. So again, proposing this withdrawal hypothesis that, again, just going to restate it, that the TBI is occurring when we have these higher levels of progesterone, and then we get the TBI incites this sudden drop of progesterone in the system, and then leading to these other symptoms or leading to the prolonged recovery and increased symptoms. So again, this piece here, there's multiple studies finding that women who experience concussion in the luteal phase of their cycle are having longer recoveries and stronger symptomology. Okay. Here's the other piece that happens. So the other question we get a lot that I do think there's definitely misinformation around is obviously then, can a concussion affect my cycles moving forward? And the answer is yes. So if you are somebody, and again, this is a question for your intakes, right? If you're a woman who's had a concussion and prior to your concussion, you were regular in your cycles or you knew the pattern that your cycles followed, and after your concussion, that shifts, that is relevant. That's important information. I've had people message me through our social media platforms and share with me that, they've gone to their physician and after their concussion, they didn't have their period for 4 months, but they were told that it wasn't related to their concussion. And it absolutely can. So there was this other study that then looked at the association of concussion with abnormal menstrual patterns in adolescents and young women. So this study looked at age ranges 12 to 21 years old. Okay. And this study found that 1 in 4 women experienced at least 2 abnormal menstrual patterns within the first 120 days after their injury, compared to only 5% of people who didn't have a concussion. Okay, that's a significant difference. And so again, the study said this disparity contributes to significantly elevated odds for the occurrence of menstrual dysfunction after concussion injury. And so the question then becomes, if that happens, who do you talk to? Right? And so for me personally, hormones are also ideally our nervous system controls it, all these lovely things. So this goes back to a few different factors. So when I think of who am I going to talk to if I'm worried about my hormones being involved, because again, this is not my area of expertise, but the people that I will guide my clients to, obviously we want to inform our general practitioners just to keep that information in a central place. But then I will, for direct access, reach out to either a naturopath who has education in hormones or a functional medicine provider. And the reason I love both of those professions is A, we can just book an appointment directly. B, they've undergone additional training in this area, but you will want to make sure, because not every naturopath works in hormones. Not every functional medicine provider works in hormones. So you do want to ask those questions. But B, what I love is these professions don't look at something in a black and white manner, right? When you go to a lab and you get blood work done, they just look at your total levels of testosterone or your total levels of estrogen or your total levels of progesterone. And there's a huge window of what is considered normal. A huge window. What I love about the providers who are more naturopathic and functional medicine in nature is that they take the information from the blood work that they look at, and they don't just look at it in black and white, as in abnormal and normal. They look at the relationship between the different components in your kind of metabolic hormonal workup. Because when you look at things, if you have something that's supposed to interact well together to then create a next step, again, not my area of expertise, right? But if you have a really high stimulating hormone and a low like output hormone or vice versa, right? The point is to look at the relationships, because you might be in the normal range of something, be on the low end of normal in one thing and the high end of normal on the other. And then what if those things are supposed to interact together to then create a domino effect? Well, if you have a low of something and a high of something, your levels aren't equal. They're not going to connect that next step as well. Really like terrible language to describe this. I hope you get the point. What I love with naturopathic and functional medicine is they don't look at the black and the white, they look at the gray. And you always hear me say, when we operate and work with individuals with concussion, we need to be confident in working in the gray because it's not black and white. Right? There's so much, the concussion is a diffuse injury that can affect the brain and the brainstem, which means we're not going to have all the answers because we don't fully understand in every way that the brain works and operates. We're learning more every single day. Heck, when we started to research concussion, we never separated out men and women. They were treated the same, and most of the research was done on men. So it's not too long that we've been actually recognizing the need to even separate gender and look at things in terms of men and women. And so if you do the blood work, or if you're concerned, so if you have a concussion and your menstrual cycles have changed after, for me, it would be connecting with someone who could help me explore this a little bit more and who has greater information on those hormones to understand, do you need support in this, or is this something that we monitor? Right? Because as we improve the nervous system and functioning too, ideally this will also help. Right? There's multiple avenues and ways that you can go approach this and monitor this and potentially treat and support the healing process in this. But again, I love naturopathic and functional medicine for this topic with people who are educated in this field, because they look at the relationship between the values and look at the gray and don't just look at the black and white. So then the next question, so back when I was doing this research a while ago, there were studies that then this theory of, well, what happens if we used hormonal contraception, right? What if we were on a progesterone-based birth control? Would that change the outcomes? And at that time, there were studies that said yes, right? So there were some studies that found that women who were on a progesterone-based birth control and sustained a concussion in that luteal phase actually supported less symptoms compared to those who weren't taking hormonal contraception, right? And so that thought was that the contraceptive, it affected the blood flow to regions like the middle temporal gyrus in that piece. However, there was a recent study done, like 2023 recent study done, and it was a large study that found there was actually no influence of hormonal contraceptive use on concussion recovery trajectory, symptoms, or cognitive function recovery in collegiate athletes. Again, they summarize more study is needed here. What they did talk about is that there's fluctuations in the female sex hormones, especially with the progesterone withdrawal. So that still stands true during the luteal phase, which then may, again, stating as well, increase concussion vulnerability, prolonged recovery time. We don't fully, to this day, understand the mechanisms. Hormonal stability from contraceptives, so using birth control, could potentially provide protective effect, but the evidence is still very conflicting, right? So again, there have been studies that have found that using progesterone hormonal contraceptive did in case help, and then there was this recent large study that found that it didn't, right? So this bigger study too, when we look at it, they talk about this concept of hormonal stability might be a factor in helping, but the hormonal contraceptive didn't show significant differences in recovery trajectory, symptoms, or cognitive function. However, what they did say is that while hormonal contraceptives did not influence concussion recovery times, females on hormonal contraceptive did display better concentration, working memory, and cognitive efficiency, irrespective of status. But then ultimately, it comes back to, again, there is conflicting information about this and more research is needed, right? And when you're looking at hormonal contraception, this isn't even a topic that I'm really going to go into in terms of the pros and cons of hormonal contraception as a whole. That is a discussion that needs to be had with your physician, and so you're well informed with any choice that you choose to make, right? So this is a quick synopsis of female hormones and concussion. And as a clinician, what this means for us is that A, we need to be asking the question, right? We talked on a previous episode, or was it a previous webinar, about the yellow flags that we can find in those first couple of appointments that may predict a longer recovery time so that we can better support and educate our clients in their own healing path. And so we need to be asking the question of when in your cycle did you have a concussion? Because what the evidence is showing is that if it is in that second half, that it is common that there's a higher symptom severity and a longer recovery time. And we can use the science to explain that to females as well, right? So that's pretty standard. This 9-day window of vulnerability, it was a small study. It's been found in a couple studies, but it's not something that's consistent. Also, we're not going to not play sport, or we're not going to not do our life because of a window of vulnerability. It's just that we know it just might exist. And then the topic of, do we take hormone contraception to help decrease the risk of concussion? Again, the jury is still out. So we don't have any definitive evidence to say if you play a high-risk sport, if you take hormonal-based, progesterone-based birth control, it's going to decrease your risk of concussion. We do not have that evidence. So again, this is a growing field. What this does mean is that it continues to corroborate that we know there is a difference between males and females. We do know that, and the studies have shown, that concussion can absolutely affect the cycles after concussions, and it's showing up to 6 months after. And so that other question as a clinician is to ask the client, how have your cycles been since your concussion? And if they have been abnormal, instinctively, I'm like, let's refer to someone who can help explore this a little closer. Naturopath for me or functional medicine are my go-to. And then obviously, if your general practitioner, if they're showing up those labs and your general practitioner can refer you to a neuroendocrinologist, if it's an area of concern, then absolutely from a traditional medicine route, it would be a neuroendocrinologist or an endocrinologist to support you in that role too. But I will say, for my clients who tend to go in the Western medicine system, that unless the blood work shows significant abnormalities, they're not able to get a referral to an endocrinologist. And so I just want you to know that there are other options alternatively in the allied health space that can also help you with hormones. It doesn't have to be a black and white one or the other. Okay, so I hope that this short and sweet episode, this little research synopsis summary for you on female hormones after concussion was helpful. For me, again, we will bring someone on who can talk about more on the impact of hormones on life. This is not my area of expertise, but for me, this is valuable in, again, how we initially approach the information we need to be asking to best support our client immediately and in a referral base. So I hope you have an amazing day. Please like, share, do all the things for our lovely podcast. We have some exciting things coming up in the next few months that I cannot wait to share with you. Stay tuned, keep being your amazing selves, and we'll see you next week. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.